I am so honored now to turn to welcome Ms. Marina Farrell, who is the Executive Director of the Changing Women Initiative in Santa Fe, New Mexico. Marina, welcome to the table.
Thank you so much. Wow, Dr. Joya and Dr. Monica. I'm just so honored to be on a panel with the two of you and just loved everything that you just spoke about. So I'm Marina or Marina Farrell, and I use she, her, ea pronouns. And I am so excited to be here today to talk about, well, actually to just sort of repeat, but in different words, what has just been spoken about. See, there you go. Thank you. Okay, so I want to begin with a land acknowledgement. I want to acknowledge and I want to thank the traditional custodians of the land on which each person is viewing this presentation and gathering today. I want to recognize their continuing connection to the land, water, and community, and further acknowledge the important role that Indigenous people continue to represent in the Americas. I acknowledge the land of my roots and where I live and work, known as New Mexico, Arizona, and the country of Mexico. I reflect on, honor, and acknowledge that we in Arizona and in New Mexico are on the stolen homelands of the original First Peoples. You can go ahead and forward. In Mexico, I want to also honor my ancestors as a first-generation immigrant, all of my relatives who taught me about traditional medicine and healing, and my mother and my father. Next. I also want to acknowledge that we're missing many voices today of Indigenous reproductive justice advocates and leaders and midwives who are bringing so much healing to their communities and who are powerful influencers of change. Just really missing their voices today. Next. I also want to acknowledge the pain and the devastation which slavery has caused and which the legacy of slavery still causes to Africans and people of African origin. I say slavery as a prayer that needs to be spoken aloud because truly enslavement continues, but it's called other names like public health, incarceration, environmental devastation, family separation, poverty, systemic trauma, overrepresentation in the rates of violence against Indigenous and Black peoples, and disparities in health outcomes, income levels, and education levels. Next. I'm not here to complain, but to speak plainly, because this work, our labor here on this panel today, is to bring change. Indigenous nations who believed in agreements through ceremony and sacrifice came to an agreement with the US government through treaties. Go ahead and hit, go ahead and hit it just a couple more times. Perfect. However, when the land was not ceded in ways that were satisfactory to the US government, it was often taken through systems that did not work for the rights of Indigenous peoples. The government of the United States is responsible for the genocide, ethnic cleansing, and forced removal of Indigenous peoples to acquire land and to control the bodies of Indigenous peoples. This brought to most Indigenous communities from sea to shining sea unbearable suffering and death, violence, poverty, and illness. And yet the land has always and will always belong to the first peoples of this continent, just like there has been and will always be Indigenous midwives. This is the knowing of the Indigenous person, the cosmic and irrefutable connection to the land and community, and the strength that ties the Indigenous peoples of the world to this earth and that which lies beyond and to that which is still to come. The root of poor maternal health outcome is due to this history, the promise to Native peoples bound by treaties that they would get health care in exchange for the precious land that withered into an underfunded Indian health services that is often inaccessible for reasons of geography or financial considerations, and frequently staffed by non-Indigenous folks who lack cultural comprehension and maybe even cultural compassion. We know that Indigenous women still, of all races, report the highest mistreatment to this day, and this is just another root of poor maternal health outcomes. A third root is the data that informs the care of Indigenous peoples in the United States, and I'm so excited that Abigail Echohawk will be presenting after this panel. It has been incomplete and totally flawed since, well, probably always, masking what is sure to be greater disparities, and it so prevents action for much needed health care, or what we refer to as making Indigenous peoples invisible. Definitions that do not speak to the culture of Indigenous peoples erase them, and sometimes they erase themselves because there's not a definition that feels safe to claim. And so anonymity is preferable to mistreatment. And I must mention the state and the national borders that keep Indigenous peoples as separate and remove them as the rightful protector of this continent's land. In terms of healthcare, the borders restrict access to healthcare providers due to geography or state and federal laws or restrictions of the local healthcare plans and insurance. These borders can also limit access to healers and medicines for and from their communities. Next slide. To illustrate, just a few months back, our Dene midwife, oh, you can go back, Nicole Gonzalez caught a baby in a hogan on Dene land in Arizona. This is a great and a beautiful event. In preparation for the birth, however, she knew that she could not file the birth certificate because she's licensed in New Mexico. So I had to attend the birth also as a non-Dene person to meet the state and federal requirements imposed on this Native midwife, this Native family, on their own nation. When we remember that every tribe is sovereign, a nation unto itself, then we remember that the families and the babies should also be entitled to birth in and among their own, in their own way, and under their own regulations. To dispel any myths that this is a rare thing, other examples are the Fort Mojave tribe, which lies in Arizona, Colorado, and Nevada, along the winding Colorado River. And there are also among the Colorado River tribes, the Chemehuevi in California and Arizona, and the Dene Nation crosses New Mexico, Utah, and Arizona. The Pasquayaqui tribe of southern Arizona is crossed by the US-Mexico border, a much more challenging separation that has caused loss of language, ceremony, and community. This further causes illness and suffering. The uniqueness and beauty of the many individual Indigenous nations in our country must be deeply appreciated.
It's 10 o'clock.
Particularly when we are thinking about the delivery of healthcare. Next slide. There are many Indigenous midwives in the Americas, but shamefully almost none in the United States. They and the Black midwives were attacked and blamed for systemic healthcare issues that endangered lives or failed to provide midwives with emergency transportation, the medicines they needed, and training. The attacks also belittled the culture of the Indigenous person, their beliefs, their ceremonies, their women. The subjugation of Indigenous practices and peoples, such as the midwife, was and often still is legally sanctioned and championed by the US system of healthcare. This disappearance of midwives is, for me, a huge root cause of poor maternal health. In this colonized lifestyle, the traditional ways of birth have been forgotten. What seems to be in the mind of many Indigenous families are the separations, the abusive ways Indigenous peoples are treated in hospital, the inaccessibilities of hospitals or even health centers, the failures of Indian health services when it comes to providing reproductive health care and abortion care. Practical solutions are to support the traditional or professional midwife in this country as an autonomous provider and ensure that Indian Health Service has adequate funding and is made accountable to honor full spectrum reproductive and pregnancy care of the Indigenous community they serve, staffed with a workforce of Native and Indigenous peoples from the same community. The medical systems also must offer reconciliation and admit to the abuses that have happened and continue to happen, including being inaccessible to Indigenous peoples, causing death. COVID-19 was devastating to Indigenous peoples, but the data still does not reflect the reality, nor do birth certificates, of how the constant and underfunding of healthcare for Native peoples is a persistent and critical issue, which could be resolved with a more realistic Indian Health Services budget that at least matches the average expense of basic healthcare for all members of tribal societies. Go ahead and, there we go. I hope that funders will fund land reclamation, the knowing that tribal communities disproportionately lack access to clean and safe drinking water, sanitation, affordable and safe housing. Road conditions are often poor, and even in the pandemic, those who relied on air and water transport were left stranded and without access to care, supplies, personal protective equipment, and so much more. Even as telehealth was made available, another unforeseen border was the digital divide, which left many communities not even able to have prenatal or postpartum care. The solution is that we must work on filling the gaps immediately with a workforce of Indigenous community-based birth workers and bring back our midwives so that every tribal nation can meet the unique need of every Indigenous person, baby, and elder living within or outside of a tribal community. You can go ahead and advance the slides. And then go ahead, there we go. A quick glance at the work that we're doing to fill these gaps is the reclaiming of midwifery and community birth, doing it with a trauma-informed lens and with full engagement in policy work for Indigenous and maternal health. Go ahead and advance the slides. I'm feeling, since Claire is there, my time must be coming to a close. Yes, okay. So go ahead and advance the slides once more. And so as we create this work, we're looking at a regional lens and we're honoring the work that has come before us. And we look forward to continuing these discussions and with appreciation to the many Black birth workers who are always making space for the Indigenous birth workers. We hope to be able to claim our own spaces and to be able to have many more Indigenous voices in these types of events. Go ahead and advance the slide. Thank you so much.
And thank you so much for the very moving comments and for educating all of us on and reminding us of this very deep history, shameful history of our country.